So I started the group more than 10 years ago when I was going through a very severe flare-up.
I found very little support in the outdoor environment.
And I didn't have anyone else that I knew, who also had eczema. A lot of them, like myself, faced a bit of bullying, in school because of their skin.
I think there's a few things that need to be done. One is patient advocates themselves. Instead of just advocating to the healthcare professionals, they should also advocate to fellow patients to explain to them why it is important to share their story.
That is actually one of the main reasons why I started the group, to provide peer support.
Hi, my name is Nan from Bridges MNC. We're a medical and healthcare communications agency. We are gathered here together for yet another podcast on medical and healthcare industries and practices. So here with me, we'll be discussing patient advocacy in Singapore, and we have two guests with us. The first is Ellil Mathiyan Lakshmanan. He is a double cancer survivor, previously diagnosed with rectal cancer and testicular cancer, and he is a permanent user or wearer of a stoma bag. He's a co-founder of the Ostomy Association of Singapore, the interim vice president of the Asia and South Pacific Ostomy Association, and mentor with the SingHealth Patient Advocacy Network. So that's quite a mouthful. And next to me, I have Ursula. She has been an eczema patient since infanthood and started the Eczema Support Group Singapore on Facebook in 2012. And today, the group now has 4,500 members, most active eczema support group in Singapore. And she recently collaborated with ACE, basically it's short form for Agency for Care Effectiveness, to push for newer treatments to be subsidized. Welcome to my podcast. Right. Today we'll be discussing the move towards value-based healthcare in Singapore and the importance of patient advocacy in this. So just to give a quick summary, value-based healthcare is a system framework that aims to improve patient health outcomes by delivering quality care at a cost that's effective. So it focuses on the entire patient journey from diagnosis right through to treatment. And this is why I have my two guests with me, who will be talking about why they've decided to be patient advocates and what have they done to promote disease awareness and support for patient networks, as well as whether or not their efforts have borne fruit and what could be expected in the future. So let's talk about what is value-based healthcare and how does it affect patients. I mean, Ellil, maybe you can tell us a little bit more about your understanding of it.
Yeah, so value-based healthcare really is giving the patient the right treatment at the right time, at the right price, right? So many patients in the past used to think that the treatment is decided by the doctor, but I think things have changed. There's no one standard treatment for patients with the same condition. Because of their circumstances, maybe their age and other underlying conditions, then they need to be given different treatment options. And these treatment options have to work for them in their own context. So to me, value-based healthcare is really putting all the options out there and giving the right treatment, again, at the right price, which the patient can afford.
Okay, let's touch a little bit more about your journey starting a patient advocacy group or leading a patient advocacy group. So maybe Ursula, you can tell us a little bit more about why you started this and how has it been since?
Okay. So I started the group more than 10 years ago when I was going through a very severe flare-up. And I didn't have anyone else that I knew, who also had eczema to talk to, and the doctors weren't really of much help also.
Mhm.
So that's why I started a group. And so far it's been good. It was a bit slow in the beginning, but now we're definitely seeing more support from various organizations.
How about you, Ellil?
It was similar to Ursula. When I was diagnosed with my rectal cancer and I had to have a stoma created, I found very little support in the hospital environment. So when I recovered, I decided that I should, first of all, create avenues for more support for people who are newly diagnosed with this condition, don't know what to do, family members don't know what to do, and that's how it all started. And of course, then it has grown from strength to strength, and so now we have a patient organization with about 800 members.
So we're looking at the current patient advocacy landscape in Singapore. So Ellil, you've lived long enough. Maybe you can tell us a little bit more about what was it like back then versus now. The relationship between patients and doctors has changed tremendously over the course of maybe 10, 20 years or even more.
So in the past, it had always been very paternalistic, right? And most patients also accept that a doctor knows best. Back then, again, we didn't have Dr. Google, right? People's literacy levels were much lower. But nowadays, that has changed. So every single thing, people just get on the internet and they look at Google and they look at Mayo Clinic and stuff like that. And when they go to a doctor's consultation, they have so many questions to ask. Some of them may not be very relevant, right? But the important thing is doctors must learn now to tell patients or to give patients more information about their condition and also put out all the treatment options out there and make a joint decision. So it has to be shared decision making. So we are not there totally yet, but I think we are getting there. So there have been some improvements.
Speaking about Dr. Google, I think because Ursula's group has been based on Facebook for the longest time, and there is a lot of misinformation online. So how do you help with combating the misinformation online, especially with regards to your patient support group?
That's a very good question because we get people coming in asking for medical advice almost every week, at least once. And everyone's kind of convinced that they know best, based on their own experience. So it's always been my role to make sure that, the information in the group is factually correct. So I have to do a lot of fact checking. We've also partnered with certain organizations, some doctors, some dermatologists, to make sure that, the members are educated on the proper way to treat or rather manage their condition.
Right. So where are we at now in terms of the patient advocacy landscape? So from what I understand, the patient does not really have a space at the table, a seat at the table, maybe 20, 30 years ago in the time of our parents or our grandparents. But now, I believe Ellil has made some advances in getting the patient's voice heard, at least at that level, the policy-making level. So what has been your experience with regards to that?
So I think the changes have been positive and really are very encouraging. Not only have we made inroads at healthcare institution level, where we have what they call patient and family advisory councils, where patients and caregivers get involved in some of the decision making to make the patient experience better. But the ministry has also initiated through ACE, which is the Agency for Care Effectiveness, they've come up with a consumer education and engagement hub. And they've invited patient groups as well as individuals to come and sit on some of the discussions and so they can contribute and inform ACE about their specific conditions. So I think these are baby steps, but they are steps in the right direction. And I feel confident that going forward, patients will have a bigger voice at the table and that the powers that be are willing to listen, all right, and shape policy based on this feedback.
With regards to the Healthier SG initiative, where patients are encouraged to take on more interest, to take on more responsibility in terms of taking care of their own health. So the role of patient advocacy has moved from the sidelines to front and center. So it's not just about very chronic diseases like cancer or eczema, like moderate to severe eczema, but we're also looking at very common diseases like hypertension and cardiovascular disease. So how do you think Healthier SG is encouraging patient advocacy to be more strengthened?
Prevention is always better than cure, and it's a lot cheaper.
Mm.
All right, and also I think it reduces the burden of cost on the healthcare authorities as well. What with the aging population, there's really increased burden, and if individuals do not take on the responsibility of looking after their own health, then healthcare costs are just going to spiral, both for the individual and the government. So I think it's a very good effort, but I feel more needs to be done. And the way they are rolling it out, I think it's almost like something that you opt out of, and that's the only way that's going to work. And getting the GPs involved, I think is an excellent move because you don't burden the subsidized healthcare system so much. So I think it's an excellent initiative, and people who move towards living healthier lifestyle tend to have less tendency to report sick, and we lose productive hours from them. So I feel it's a step in the right direction, but there's still some way to go to convince everyone that this is something that they should take upon themselves.
Right. So Ursula, what are the main challenges that you face in managing and growing your patient support group?
Well, firstly, we don't do any active outreach. So we have to sort of wait for people to come and find us online. Like, it needs to occur to them that, hey, I can search for eczema support groups online, and that's how they usually find us. Otherwise, sometimes it's through word of mouth. So the biggest challenge would be, just for people finding us.
And linking back to what Ellil said about taking on responsibility for your own health, and we're moving towards that sort of patient advocacy.
Yes.
Do you see that happening, or are people still kind of relying on others or the government or whatever other parties to support their own health?
I think for us it's a very unique situation because there's a lot of mistrust between the patients and the doctors. So they tend to take it within their own hands, but sometimes they run off in the opposite direction. They think they know better than the professionals, and that can be very detrimental to their health. So it's been a challenge to try and find a balance, where yes, you are responsible for your condition, but you also have to listen to these professionals.
Yep. So Ellil, maybe you can tell us more about the challenges of just trying to get patients together, because that has been a challenge for you to get them interested in knowing more about the condition and supporting themselves.
So again, there are two groups of people. Like what Ursula said, there are some who are very proactive, right? They go online and they search and then they reach us. For the others, some of them are just resigned to the fact that they're this condition, and they wait for the doctor to put forward the treatment options, and once they are done, they don't want to have anything to do with the condition, right? But more often than not, we need to entice them to come to us. One of the ways we do it, we work with the appliance vendors, the medical device vendors, to offer discounts to people who sign up as members, right? We ourselves do not charge any membership fees. So the membership is absolutely free, and we encourage these people to join us by, number one, giving them some discounts through the vendors, and number two, we have this thing called a medical ID card, which is something which they can use to maybe produce at immigration checkpoints to show that they have this condition and to have a doctor present to avoid any embarrassment, right? So these are the things that we are trying to use to increase our membership and also to raise awareness.
So we can talk a little bit more about, say, the role of caregivers, especially in your instance, Ellil. Are they learning more through such organizations?
Yes. So we do collaborate with other social service organizations, particularly like 365 Cancer Prevention Society and Singapore Cancer Society, and we conduct courses for caregivers. All right, we get people who have had the experience to come and share. We also have the stoma nurses to come and talk about common complications and what to do when something happens. All right, so and you're right, caregiving for an ostomy is not easy. it is a whole new game as compared to normal diseases. And yes, caregivers are sometimes neglected, but we are trying to address that by putting forward more resources, not only for helping physically but also psychosocially.
So, looking at mental health support, I think eczema patients, particularly those who suffer moderate to severe forms of the disease, they do need that sort of community and mental health support. So, how is it normally encouraged in your group?
That is actually one of the main reasons why I started the group, to provide peer support. So a lot of them, like myself, faced a bit of bullying, in school because of their skin. Because kids, they don't understand the condition, so they say things like, "Oh, you're dirty, you don't bathe," that sort of thing. So that can really take a hit lah on people's mental health and their self-esteem, especially when you're so young and growing up. So in our group, once in a while we'll have perhaps a parent sharing a story about their kids and asking for advice. Oh, what can I do to help boost his self-esteem, make him feel more confident? And everyone is really amazing because you see all sorts of people rallying together, from different ages, and they'll just send words of encouragement and say, we've all been through something similar. Don't tell your child, don't let it get to them. People are just like this because they don't understand, or they are sometimes afraid. So try not to take it to heart.
So, considering that cancer can be a death sentence for many people, how do you put together or strive to put together mental health support for patients who have been diagnosed with cancer or facing the possibility of having to wear a stoma bag for the rest of their lives?
I think one of the main things that needs to happen is for them to realize that there are resources. All right, they have avenue for support, and I think the healthcare system can do a bit more in this aspect, right? To tell them that, point them to the resources, right? There's nothing like someone with lived experience talking to you to convince you that there is hope. And we are walking examples, right? I had a stoma created 13 years ago. And here I am, when I tell them I go swimming, I go dragon boating, and they feel very encouraged. They feel very reassured. So I think coming from someone who has walked the journey is so important. And to tell the newly diagnosed patients that there is help, right? There are people willing to hold your hand and walk the journey. It's important. And I feel that the nurses and the doctors can do more by pointing the patients to these resources.
So, what can be done to improve the collaboration and communication between the stakeholders, for example, the doctors, public health hospitals, for example, and even policymakers in helping patients make the right decisions for themselves and helping caregivers to do the same?
So I think I want to again mention what ACE has done, coming up with the Consumer Education and Engagement Arm. What they are doing now is they are coming up with information leaflets for various conditions, right? And when they produce these leaflets, they actually run them by the patient organizations to get feedback on whether it's too technical, whether there's a lot of jargon, whether the language is understandable. So once they get all the feedback and they're satisfied that it's going to be useful, they release it to the public. So people suffering from any particular condition can learn from the information on these leaflets, so that when they go and see the doctor, they already know something about their own condition. They will know how to ask the right questions. And from the doctor's answers, then they can choose a treatment that is right for them. So they make the decision jointly with the doctor.
So, back to Ursula, with regards to healthcare decision making in your group, I understand there are parents of eczema patients or very young patients with eczema. How do you advocate for the right decision making in terms of healthcare for the children?
With the help of some dermatologists or healthcare professionals, I always remind them that, it's best to listen to somebody who's gone to medical school versus some random on the internet. But that is honestly as much as I can do. Oh, I can also share about my own experience. Like, for example, when I went to when I went for phototherapy. So every time I see a doctor, I always share about my experience with the group in hopes that, it will help reduce that fear.
So there is obviously a lack of trust, in some areas. The patients do not trust the physicians. They might not even completely trust the healthcare system. And there have been some research or initiatives to help with getting more information from patients and also to do more research into what they need and the kinds, maybe even trials that are more patient focused as opposed to just see whether a drug works or not. So maybe Ellil, could you address that part about the research?
So, thus far, the patient advocacy work I've been involved in is with patients and caregivers working with clinicians to improve better outcomes in a clinical setting. But recently, there has been another group that has been set up to have the same kind of collaboration with medical researchers and educators. And I think this is going to go a long way, in answering your question about how patients can give the input to shape research and medical education for better outcomes for specific conditions.
So, Ursula, you've attended some of these courses organized by research institutions with regards to conducting more research on patients and getting more information from them on how they manage diseases. So, how much of that could be applied to your own group, and how much of that could be useful?
To be honest, I'm still figuring it out, but off the top of my head, I think, firstly, it's great. I feel like there's hope that, for all of us because they're finally focusing more on the actual patient experience, versus just seeing us as people on a conveyor belt. This is what your problem is, now go. There's more like, oh, how does it actually feel for you? How did it actually affect you? Did it do what it was meant to do? So I think it's great that we're going down this path.
So, what do you think that could help in terms of improving the landscape? When I say the landscape, I'm talking about patient advocacy, encouraging more patients to join hands, and encouraging more physicians to have this a closer collaboration that could be even escalated to the policymakers, where they could make decisions that put patients center of everything that we do.
So, I think there's a few things that need to be done. One is patient advocates themselves, instead of just advocating to the healthcare professionals, they should also advocate to fellow patients to explain to them why it is important to share their story and maybe even help them articulate if they are not in a position to, tell their story by themselves. So that's one part of it. The second part is you need to start at the medical education level. Don't wait until they become full-fledged doctors. And then it's quite difficult to change things sometimes. So I think when you go down to the actual training and incorporate this into the curriculum, then I think it can help them approach their work in a more humane way and not just treat the person in front of them as a patient and ask not only what is a matter, but also what matters to you.
So we're coming to the end of the conversation, and I have a couple of questions for the patient advocacy leaders here before we end. So, Ursula, what else can be done in the patient advocacy landscape that would be helpful to improve patients' lives in the future? I mean, considering all the things that have been done now.
Top and foremost on my list is to subsidize all the new treatments, not just one. Because recently there was one that was subsidized, but that's just one of the many. So I think it would be a great help if the government could provide more assistance in that field. Secondly, definitely the usual fight against misinformation. There's still a long road to go, so that is also very important. Thirdly, I guess it would also be good for everyone, like the general public, to recognize that eczema is not contagious. Please don't make fun of us. Please don't make us feel worse than we already feel.
So you're looking at more compassion and understanding. I mean, this is the age of the internet, right? So like I think people are practicing or trying to encourage other people to practice compassionate understanding more so than maybe 10, 20 years ago. So how about yourself, Eddie?
For me, I think first of all, there needs to be education on both sides. Patients also need to be educated about the fact that things cost money. The pharma companies are not charities. They have a bottom line to look at. The government has to find the money to pay for healthcare as well. So I think a little education for the patients might help them understand the cost of treatment and stuff like that. But at the same time, I think we also need to create a framework where the government and the pharma companies and the patients, so all the stakeholders come together, all right, to see what the real problem is. And the thing is, it's all about the patient, right? And you need to make sure that treatments are affordable for all patients, not only those who have good insurance policies or those who have good. And I think right now that is not happening. The patients are talking to the pharma, the patients are also talking to the healthcare authorities, but there isn't a forum where all three can come together and sit down and come to a proper solution. So I think that will help.
And there you have it, the current patient advocacy landscape by our two guests, Ellil and Ursula. Thank you for being on our podcast, and we hope to see you again for our next podcast on medical and healthcare industries and best practices.